Thank you. Good morning, everyone. Mike Greenberg with Eagle Pharmaceuticals, and I'd like to talk to you about industry's response to mitigating potential medication errors in simulation training. So simulation training enhances emergency preparedness. Simulation training originated in the aviation industry, and although it's used throughout healthcare today in many different specialties and many different facets, anesthesia pioneered the use of simulation in the healthcare setting. The medical literature supports the fact that simulation-trained HCPs recognize emergency conditions better and more rapidly. They also manage these medical emergencies better, and simulation training is also an opportunity to identify areas for improvement. Malignant hyperthermia is a pharmacogenetic disease. In individuals who have the mutation or malignant hyperthermia susceptibility trait and are exposed to a triggering agent, which is certain anesthetic gases or the paralyzing agent succinylcholine, they may trigger with a malignant hyperthermia crisis. And malignant hyperthermia crisis is a hyperthermic, hypermetabolic crisis. It's rare. MH is not a mandatory reporting. However, we believe there are between 600 and 800 cases of MH that occur in the US every year. MH is unpredictable because everyone who manifests or harbors an MH susceptibility mutation does not necessarily trigger with an MH event on every exposure to a triggering agent. So it's rare and it's unpredictable. However, the incidence of the MH susceptibility mutation is between 1 in 2,000 and 1 in 3,000. So the risk of MH is far greater than the incidence of 600 to 800 cases a year would imply. Outcomes in MH are directly related to the time to recognizing and treating MH, and the key steps involved in treating MH include, among other things, removing exposure to the triggering agent and administering the antidote to the crisis, which is intravenous dantrolene. Routine training has been demonstrated to improve outcomes in patients who suffer from an MH event, and it likewise improves MH preparedness. In fact, routine training is mandated by multiple accrediting organizations within the healthcare space. Eagle manufactures a unique and proprietary concentrated nanosuspension formulation of dantrolene sodium. It's called Ryanodex. And Eagle also makes Ryanodex drill vials available to hospitals and health systems to support education, malignant hyperthermia, simulation, and training. Eagle has provided these drill vials to licensed HCPs and facilities for actually almost 8 years at this point. We also make them available through a partnership with the Malignant Hyperthermia Association of the US. And to date, we've disseminated almost 20,000 drill vials, which have been used for education and training throughout the country. So on the left, you'll see what the live or commercial product looks like for Ryanodex. And in the middle image, you'll see the Ryanodex drill vial. So this is how it was conceived at the inception of the program. And you'll note several differences between the live product and the Ryanodex drill vial. Specifically, there is no NDC number on the drill vial. There's no expiration date on the drill vial. Likewise, there is no barcode on the drill vial. Demo has been added in capital letters after the lot number, and there is auxiliary labeling indicating that it is for training purposes only and not for human use. And lastly, there is an auxiliary overseal tape over the drill vial. So these were the original safety measures to reduce the risk of a drill vial inadvertently being administered to a patient during a malignant hyperthermia crisis. In June of 2023, ISMP informed Eagle of an intercepted or near miss medication error. There was a hospital which stocks Ryanodex for the treatment of MH. They had requested drill vials from Eagle, which were provided, and that drill vial was then shelved in an area where live product is contained, most likely in a dispensing cabinet. Now, the storage error was identified before the product was used for patient care, so this wasn't actually a medication error, but it was a near miss medication error. And in addition to notifying Eagle, FDA was informed of this near miss error as well. So how did Eagle respond to this? Well, first and foremost, we needed to discuss this, the potential changes that were needed to mitigate this identified risk with leadership. As I'll demonstrate in the next couple of slides, maintaining this drill vial program and supporting MH education and simulation requires a significant commitment in terms of both manpower and funding. I'm happy to report that leadership was in favor of continuing to support education and training in the MH space. So once we agreed that we would proceed with updating the drill vials and the labeling to mitigate this risk, we conducted a root cause analysis as well as a targeted or modified failure modes and effects analysis to develop an action plan for addressing this issue. The action plan was two-pronged. There were some process improvements that were identified, such as providing alternate shipping location for these drill vials, so not going to the main pharmacy area. This was something that was not necessarily done previously. Another process improvement was, again, suggesting, we can't mandate this, but suggesting that the drill vials be stored in non-patient care areas. At some facilities, this is quite practical where they have a separate classroom setting and they're able to get all the different shifts of healthcare providers who require training into that classroom setting for the training. Other times it's a little bit less practical, and the only time you're really going to have the groups together may be at shift change at the OR desk, and so it's a little bit less feasible to store this training product in a non-patient care area. And auxiliary labeling within whatever area the drill vials were stored was another potential improvement that was identified. We also identified opportunities to update our drill vial product to reduce the risk of potential medication errors. And those include improving the visibility of the auxiliary labeling and demo, and improving the visibility by changing the color of the font, and likewise moving that auxiliary labeling to above the product name. In an emergency setting, it's not uncommon to reach into the drawer or reach into the Pyxis, look at the product that you're grabbing. As soon as you see the name, you stop because you think you've identified the right product in an effort to speed patient care. So this way you'll identify the auxiliary labeling before coming across the product name. There were also certain other improvements we were able to make, which I will share in the coming slides. So how did this process play out for updating the drill vials? Well, when the complaint was received, it's actually relevant to two different functions at Eagle who were necessary to investigate that. The first was pharmacovigilance. So again, this was a near miss, so the medication was not administered. However, had the medication been administered and had there been an associated adverse event, that would have been within the purview of the pharmacovigilance team. It also is relevant to the quality assurance team. Again, had this medication or drill vial been administered and there was no efficacy observed because it was training material, then that would have been lack of efficacy, which is a product quality complaint. So both functions needed to investigate the complaint. The two options would have been to discontinue educational support for the malignant hyperthermia space, or to update the drill vials and the educational materials appropriately. We obtained approval from leadership to update the materials appropriately. We convened a working group, and that working group, the members were listed on the previous slide. Multiple functions across Eagle were involved in both identifying the changes to be made as well as approving them once they were made. We also turned to outside experts. ISMP was instrumental and invaluable in providing suggestions for updating the drill vials to further mitigate risk, and there were several external consultants that Eagle works with as well. There are 4 different types of print materials which needed to be revised and updated. One was the carton in which the drill vials are stored. Next is the labeling for the drill vial itself. The package insert that's included in the drill vial is the third one. And lastly, we needed to modify the over seal tape. Once those revisions were identified, SOPs needed to be put in place to accomplish this. There are actually 2 sets of SOPs that are required for this as well. How is this going to be handled internally at Eagle. And then likewise, the product is shipped and disseminated through a distribution center that is run by a third-party logistics partner to Eagle. So we needed to understand how the process would be modified there and certainly work within their SOPs as well. Once that was all accomplished, the distribution center needed to update all of the drill vials. That was done. We at Eagle needed to confirm that all of the changes were done appropriately, and then we moved into the program maintenance phase, which is where we are now. So all of these processes were performed under good manufacturing practices. A normal timeline for a relabeling project such as this is between 6 and 8 months. This project, I'm happy to report, was accomplished in 4 months. These drill vials are quite popular and they're used as educational resources and tools quite frequently. So we recognize the importance of accomplishing this rapidly so as not to limit the supply. And now we are well into distribution of the updated or modified drill vials. So this is what the updated drill vial looks like. You'll see that the auxiliary labeling now has a different color background from the live product. And again, the auxiliary labeling is now above the product name. So if someone is scanning down the carton, they'll encounter the auxiliary labeling before the drug name. A new yellow wafer seal was added to the top of the carton. So again, you'll have to open that wafer seal and see the word demo on it. The auxiliary labeling was changed on the top of the carton. And with these improvements, we hope that we've mitigated the risk of any subsequent near miss or medication errors. So in conclusion, I'm delighted that Eagle has maintained its commitment to supporting education and training in the malignant hyperthermia space. It really does take a village to both implement a project like this, as well as identify opportunities for improvement. And we hope we've mitigated the risk of any potential medication errors. So I know, the other slide didn't. I know we're saving questions and comments to the end, but I would just like to acknowledge both ISMP, their counsel throughout this process has been invaluable. And I'd like to thank my internal colleagues at Eagle. Again, it was a cross-functional team who made this possible.